say to you about pediatrics. These are very important, and I also review cancer. Also, that Dr. Etedal said to you about it. I review it in this part. That's repetitive for you maybe. And this is the chart of different cancers in pediatrics. You went for internship to adult cancer? Yes?
Yes.
You went?
Yes.
And see them?
Yes.
Okay? Which cancer was the most important cancer in adults?
Leukemia.
Leukemia.
Yes.
What about children?
Also
See this graph. See this graph, please. You can see the first leukemia in pediatric is also leukemia. The most common is leukemia also. Okay? We will go with you in internship. In Karbala, you have cancer for adults.
Yes. Yes. So
What
many.
hospital?
And Hassan.
Karbala. Okay? If they let us, we will go with you to leukemia ward, cancer ward for pediatrics.
Also, there is a for pediatric oncology.
Okay, yes. This is a disaster for parents that have a pediatric with cancer, with leukemia. Number one is leukemia. Number two. Number two. Lymphoma. Number three.
Williams tumor.
Williams tumor, I will say to you. And brain tumor, pay attention in pediatrics very much. Brain tumor, for example, we had a 6-month children with brain tumor. Brain in a spinal cord also we have in the pediatric wards. What is this? What is leukemia? Leuk means white. Anemia means blood. Leukemia means blood full of white BC. Okay? We say leukemia. This is in this book. The incidence of cancer in children and adolescents in Iraq, in the world, in Iran, in all of countries is 18.8 cases per 100,000 children. Okay? This is not rare, but we have more cancer in children. Boys get cancer too or males? Male or female?
Female.
Which one?
Female.
Which one in the pediatric?
Females.
Boys. We will go to the pediatric wards of cancer. You can see boys more than girls. Why?
Why? I asked you why.
Because it's
Unknown.
unknown. We didn't know. We didn't know. Why the boys get cancer more? Because of women.
Yes,
They
correct.
are children.
Yeah.
About 6 months. Pay attention. That is more. The ratio is 1.2. You are 2 more than girls get cancer in pediatrics. Pay attention. The cause is unknown. We didn't know. The age of 0 to 4 years, 0 to 4, and adolescent in more. Why? Why adolescent get cancer
Hormonal
more?
life change.
Why 0 to 4 get cancer more?
They change.
Unknown. You didn't know. It's unknown.
Is it because smoking?
لا هو unknown no.
You're speaking about children 0 to 7, not smoking. Adolescent maybe, but not related to smoking. It's unknown.
دكتور احمد يسولف.
Unknown.
وين سالفة؟
If we'll go with you to Karbala's hospital and you see at the first acute lymphoblastic leukemia, number 2 lymphoma, and number tumor, number 3 tumor is central nervous system tumor, brain tumor. Okay? In pediatrics. Etidal said to you about one of the first question parents of newly diagnosed children with cancer ask you, how did my child get this? What's your answer?
There is no
Yeah.
primary cause.
Your child
There is no
good.
reason.
No, we don't know.
Don't know. It's unknown.
Idiopathic.
For example, a mother said to me, I have stress in pregnancy period. Is it possible for getting cancer in my children?
We don't know.
It is unknown. Okay? They are stressful. What's the etiology?
Not
The first unknown. Number 2, genetic. All of things that I said to you up to now, I said genetic.
Doctor, what about radiation?
I will say to you, yes, maybe. Genetic and unknown, pay attention. Risk factors. We have some risk factors. Number 1, radiation, carcinogenic drugs, immunosuppressive therapy, Epstein, that's a virus, maybe in pediatrics led to cancer. And the genetic conditions, in some genetic conditions we have more cancer. What are these? For example, certain drugs like radioisotope drugs for cancers and immunosuppressive agents can increase risk of developing child cancer, especially adolescents. Okay? These are some drugs that we use for radiation in some wards that maybe led to cancers in children. You know? Radioactive maternal type A package, for example. For mothers, if we do some of radiation for mothers in pregnancy period, maybe cancer for children.
Yeah.
Is it possible?
Possible,
Yes.
yeah.
Pay attention. This is usual. For confirming cancer in pediatric, we do several laboratory tests we do for them. Do you know what are these tests?
CBC.
Number 1,
Laboratory.
CBC.
Yeah.
Laboratory test. For example, CBC. In CBC, you see
white blood.
White blood cells.
increase. How
Yes.
is normal of your white BC?
11 to
What was your name? What was your name?
Farce.
Farce.
Yes.
How many white BC Farce have in their blood, in his blood?
11 or 16.
16?
No.
16?
No.
You have 16 white BC.
That means infection.
You are in danger of infection. How many white BC you have?
4,000 to 11,000.
4,000 to
11.
11. Yes. 5,000 to 10 or 11. All of the in this class have white BC about 5 to 10,000. In cancers, it's elevated. For confirming cancer, we do this test. What is this? What is this?
Blood.
Do you know it?
Yes.
What is this?
This when you take blood from
Okay.
limbs,
Under,
for example, and
micro.
a slide, you put the blood
PBS.
and see
Okay.
it on the microscope.
Peripheral blood smear. Maybe you did. Okay. In the laboratory, you see it. Okay. Take a drop of water of children, put in this lump, and color it and see under microscope and see cancer cells, blasts.
What about bone marrow?
I will say at the first, pay attention. At the first, we get a CBC.
Yeah.
If the CBC is
High white.
high white BC, we do the second step, getting PBS, peripheral blood smear. It's number 2. We see blast in this lump, okay? After that, for confirming again, we do bone marrow aspiration. This is blasts. This is a lump that you can see platelet, eosinophil, neutrophil, basophil, RBC. Under microscope you can see, okay? A peripheral blood smear test is a technique healthcare providers use examine your red and white blood cells and your platelets, also check under microscope. A biopsy maybe from bone marrow or other tissue, you can get biopsy. For example, if your lymph node is enlarged, maybe take a biopsy.
Yes.
If you have a tumor maybe in the abdomen, maybe get a surgeon get a biopsy. But for leukemia, okay, we didn't need do biopsy because you didn't have any tumor, okay? You have only white BC higher than normal. In some tissues, in some malignancies, sometimes do tissue sample. For example, we had a children with liver tumor. Liver tumor. What is this?
What?
Liver tumor. We had a children
Yes.
with liver tumor.
Yes.
Can we do biopsy for these children?
Of course.
It was separate.
Yes,
No.
why not?
Of course
We
can.
use biopsy for them to confirm
If it's benign.
the malignant or benign of this tissue. Pay attention. Sometimes we use tissue sample. Pay attention. As I said to you, cancer related to your genetic. We do genetic tests for children or youth about their cancer. If you have in the genes of adolescent or children translocation known as Philadelphia chromosome. Philadelphia chromosome is a chromosome in malignancies. If is found in approximately 5% of children with ALL, this is poor condition. Okay? Genetic is very important, and chromosome studies is the first test after confirming cancer for children. One of them is Philadelphia chromosome, that is abnormal chromosome. You can find it in cancers of children, especially in ALL. Philadelphia chromosome. Number 2. What is this?
Biopsy.
Bone marrow aspiration. You see it in adults?
Yes.
Yes.
When you went to adults ward, are you see the bone marrow aspiration? No? No?
No,
No.
We don't see this. Bone tissue.
محمد ينطبق
No,
Doctor.
okay.
No.
Bone marrow aspiration
We
from
don't see
bubble.
that.
How did we do this for bubble, for example?
No, because
No.
they said they give the patients some drugs that they can increase the immunity for
How
them.
you confirmed your cancer in adults, in children? By biopsy. Biopsy is necessary.
I've seen biopsy, but the bone marrow transplantation.
Bone marrow aspiration.
I've seen it.
Aspiration.
And
No.
the
I've seen it
best
Aspiration.
at Warif Hospital.
Forest hospital.
Yes.
Yes, I have at Nasser.
Everywhere that you have oncology ward, you can do this.
But
Okay,
we don't
because
see
you
the
should
spinal
confirm
cord.
the
Doctor,
cancer in adults.
spinal cord. I see.
Aspiration, spinal cord aspiration.
Yes, doctor. Only.
We do in pediatric wards, we have a clinic in Iran for bone marrow aspiration. The children come to clinic under anesthesiologist, do bone marrow aspiration for confirming it's necessary do. Okay? You can see in these clinics a needle, that's aspiration needle, and go to crest iliac in the back and get bone marrow aspiration. Mohsen,
Yes.
where is your iliac crest of you?
On the head, is it?
Check your iliac crest for yourself. Posterior. If the doctor wanted to get bone marrow aspiration, they get from his bone. The needle goes through outer layer of bone until it reaches the bone marrow space. It goes down to the bone marrow and pull the posterior superior iliac crest in the baby. Pay attention, it's too thin and too sensitive. An experienced doctor should do bone marrow aspiration. This is.
Doctor, do you give him anesthesia? Do you give him
Yes.
anesthesia?
Yes.
Local. Local.
Local, no.
Is it-
No,
It's a
general.
painful procedure.
General.
Yes, just the
General.
local.
Yes, for pediatric. And also for adults. That is too painful.
Yes.
With a big needle like this goes to your bone. For pediatric. That
And
is
spinal-
too painful.
And spinal
Why
also.
do the surgeons
General.
choose this side to take bone marrow sample?
Because it's not responsibility of surgeons. It's related to oncologists. Oncologists do this. Okay?
Why do they choose this side
This side.
specifically?
Because
Right
this
side.
side is the better one for getting bone marrow. It's the best place. Okay?
What is related?
This is a syringe and they aspirate bone marrow and send it to laboratory for some genetic tests for confirming cancers in children.
Doctor, how are we sure that's not blood?
Not,
That is not blood.
it's on the bone marrow. I'm
bone
sure
marrow.
that I went with this needle to iliac crest. Go to the bone marrow, to the center of your bone. Okay? This is bloody. This is bloody, like blood, but that is bone marrow aspiration. Pay attention. And also, sometimes they
Spinal
do
cord.
LP, you know, lumbar puncture.
Yeah.
Why we do in
Mustafa.
cancer patients for detecting cancer?
Is it to detect if it's infection like meningitis or
this is cancer. Your patient is a children 0 to 4. For example, she has cancer. Why we do LP also for them?
To know if
To rule
this
out.
cancer.
Rule out
Yes.
metastasis. You know metastasis?
Yeah.
Maybe these children has metastasis to the brain.
Doctor,
Okay.
do they do this procedure under anesthesia?
Yes.
Yes.
Oh
General.
my God.
General
I've seen it
anesthesia.
without
We are
anesthesia.
children.
General.
We have a children about 1 year old. Okay?
Yeah.
We have a children, we have an adolescent full of stress. And we do under anesthesia for children.
Okay.
Maybe for adults, no. But this is a painful procedure. We do
Doctor,
it.
but
Doctor, I
why
have
is
seen
it general? Why is general anesthesia? Why is not
Most-
local?
Pay attention, these are children. For example, you have a children 1 year old.
Yes, doctor.
Also,
In many times in my clinic, we do with under general anesthesia. But that's limited with low drugs. Okay? Not with deep,
Yes, doctor.
low. I don't know about your country.
For half.
We will go
Oh.
to your country, to your wards and see what did they do.
They
Also,
have done it
general.
without anesthesia. I have seen them also in a war if the doctor did it. But then,
It was for
Good
adults.
no, it was a
No,
child.
for
Child.
child.
Yeah.
جاد لا
أنا شفت
مستشفى زي العابدين.
من الوار.
مجتبى.
better.
المجتبى.
It's
Ah,
better.
wow.
You'd better to know a standard.
مجتبى مصطفى.
واحد طلع على
A
ظهره.
standard. If you go, for example, to America, maybe you immigrate to America, you can see they said to you the standard is general anesthesia because this is a painful procedure. Okay? Very, very important for a children about 3 years old. This is very painful situation. Pay attention, general anesthesia in these children not very deep. Okay? Very, very
the little
quick.
dose of the anesthesia.
Yes. LP is a routine test employed in leukemia, brain tumors, and other cancers, metastasis to CNS. And pay attention, we have a word that is intrathecal drugs. Do you know what are these? For children, if you have metastasis to the brain, we inject some chemotherapy drugs into trachea. We do LP and inject chemotherapy drugs to the LP situation. Why?
To
For
prevent
metastasis to CNS. You know? Pay
Just
attention.
one cycle, enough? One cycle of chemotherapy for this one,
Yes,
enough?
yes. Sometimes yes, sometimes repeated. For example, every month the children comes for intrathecal injection.
To cheat.
Is it on the anesthesiology? Yes, we do it. You know we have two types of leukemia in pediatrics. Dr. Etedal said, yes? ALL or
Yes,
AML. You know?
Yes.
For adults
Yes.
and also for children. For children, ALL is common, acute lymphoblastic leukemia and acute myeloblastic leukemia. Which one in pediatric? Which one in adult?
The common, yeah.
Also, okay? Which one is better? You get ALL better or AML?
I am.
ALL is better than AML. If you get AML, this poor prognosis. Okay? ALL, what is ALL? As you said, leukemia is an unrestricted proliferation of immature white blood cells. We say in leukemia, white BC is more than normal, okay? But we say leukemia patients get infection more. Why?
Because the white blood cells are immature, not
Immature. Pay attention. These are immature and not good developed. And these are not good for defense.
Against infectious organisms.
Okay, we will go to cancer wards. Maybe they didn't let go to the ward.
Yes.
They say,
immunosuppression.
yes, they say they have immature white blood cell and they are in danger of infection. Maybe they don't let to go to the oncology ward. You know, you have stem cells, me, you, all of us,
Stem cell.
in the bone marrow have a stem cell.
Yes.
Okay? Stem cell in the base cell for blood synthesis, divided to two group production. Number one is,
Lymphoid stem cell.
number one, the left side is
Myeloid
myeloid stem
stem
cells,
cell is
myeloid blast, platelet, and white BC. And this part is lymphoid stem cell, lymphoid blast, and white BC. If you have cancer in this part, we say ALL. If you get in this part of bone marrow, AMN. Okay?
okay.
Bone marrow of you involved in cancer based on stem cell. 84 is ALL. In pediatrics, said to parents, said to mother, said to father, that's best prognosis. Don't worry, ALL has best prognosis. Many of them stay alive. Don't worry, but something this the other slide shows. Pay attention, presenting the cancers in children, what signs and symptoms they have. What symptoms? You went to adult cancer. What did you see?
Hemorrhage.
Hemorrhagic, you see. In adults, at the same, give me example in adults that you went.
Pale
Infection.
skin.
Recurrent infection.
Recurrent infection, number one. Number two,
Ulcer in the mouth. A pale skin. Their skin is pale.
pain,
Ulcer.
Bleeding.
infection,
Bleeding.
bleeding,
Fatigue.
fatigue. Taha, why they have bleeding? Why ALL children have bleeding? Father comes to your clinic and say, my children has epistaxy, bleeding.
Related to the
Increase,
blood related.
increasing
What blood
or decreasing? Why decreasing? Why decreasing? Why decreasing, Thomas? Hassan, why decreasing? Hassan, say something that I be happy. Why decreasing? Platelet is related to your coagulation. If it decreases, you have bleeding. In ALL, you have decreasing platelet. Why? Why, Zainab? Zainab? Zinat, why? What? Platelet factor? Zahra. Why platelet decrease?
Can I answer?
Because the body try to, the organ liver and bone marrow try compensate and produce white blood cell because there is a mixture
Because
of
your
blood cell.
bone marrow is trying to produce vitamin C. And
I
let,
have time to
okay, and platelet is decreased. Okay? Fatigue, why they are fatigue? Hassan, why they are fatigue?
Lower it.
Where are you good? Bathroom. Say to this question I after go. Yes. Why they are fatigue? ALL patient, cancer patient are fatigue all of times. Why? Why? Anemia. Why they have anemia? Why they have anemia? What is it? Why they have anemia? Why?
It's a gift here that
Why they have anemia? I didn't want it.
Red blood cells down.
Anemia. Yes.
Because the blood is not.
Okay. Why?
It's maybe the genetic.
Where are you from? Karbala.
Yeah. Party. I wish I was in Germany.
Why they have fatigue?
Because the patient have anemia, and they
Anemia. Why they have anemia? Decreased oxygen led to anemia.
No.
Why they have anemia?
Because red blood cells are very.
Why cancer children have anemia? Okay, bone marrow. Okay, bone marrow. Focus on all of these lower and left anorexia. Why? Iron deficiency. Okay, thank you. Hemorrhage, fetish, purpura is related to cancers. Bobby,
Okay.
you are asleep.
I am tired.
What is it? Fetish and purpura. These are related to platelets. Decreasing platelets led to bleeding in skin. We have hepatosplenomegaly. Do you know why?
Yes.
Why?
This organ
Ah.
try to compensate because low red blood cell and high white blood cell.
The most important is infiltration white BC to liver and spleen. Metastase.
Yeah.
You know metastase?
the spread from
White BC goes to liver, to a spleen, and let them to be big. You have a splenomegaly for them. Therapeutic management. After confirming that your children have ALL, what's treatment?
Give him chemotherapy.
You see for adults, you see chemotherapy for adults in oncology wards. What the name of some of the drugs? Could you say some of the name drugs? What was your name? Sadek.
Chemotherapy.
Sadek, you were in my class. All of my class you were. No? Yes or no? Absent or no?
Yes, yes.
Where are you? What city you are?
I'm tower.
And Tamar.
What?
Tamar.
Karbala. What was your name?
Haida.
Sadek? Haydar? Sadek or Haydar? Ah, at the first, Sadek, Haydar.
The second Haida.
From Karbala. What was your talent?
Stevie.
Don't worry, I wanted to ask again her talent, his talent. What was his talent? See? Joiner, what is joiner?
Joiner. The man who makes
A carpenter, doctor.
Yeah.
A carpenter.
Carpenter, okay. Okay, what's your idea? Let the Haydar, you have a question?
They have one.
No. Okay, let the Haydar, Sadek, Haydar, Sadek. Okay. Cisplatin, okay. For adults, not for children. And the other names. He is silent and focus on me and
He thinking, doctor, he have another one.
Doctor, we didn't take these, the name of the cycle. We didn't take in chemotherapy center.
okay.
Tell Christine, doctor.
Treatment of leukemia involves the use of IV and intrathecal. What was intrathecal?
By spinal cord.
It's question of exam. What's intrathecal?
Question of exam.
Intrathecal chemotherapy.
Spinal cord.
Okay? Used for resistant CNS disease or testicular relapse. Pay attention. Something that's important for adolescent. You as a man pay attention. In adolescent, maybe in boys, they have metastasis to testis. In the future, maybe these adolescents be infertile. You know, pay attention as a man, know that ALL may be metastasis to testis and lead to infertility in the future. Treatment, sometimes surgery for some tumors. Yes, and also you have in your country bone marrow transplant or no?
Yes,
Okay, but city, Baghdad, Karbala, for children?
Yes.
Great, very good. We did so.
Doctor, we are full of hospitals on Central.
That's great. We will go if they let us citarabine for pediatrics. We use some special drugs that is citarabine.
We have to memorize this one?
No, only see them and remember the names. If you hear in the pediatric ward citarabine, you know that is a chemotherapy drug. And what is this? What is this? Mustafa, what is this? Please put your glass and say to me, what is this? What is this? Methotrexate. It's usual drug that we use for pediatrics. Methotrexate. You see here?
Yeah.
The name. Only hear the name of these drugs, okay? These are very special. These are drugs, okay? You can see all of these drugs are from America or Germany. They are very expensive, very expensive. Pay attention. If one of these drugs fell down on the ground and fractured, you are responsible because these are very expensive.
Doctor, we didn't prepare this one. The pharmacist
Yes.
prepare on solution and after that give it to us.
In Iran, nurses in oncology ward provide them. I don't know about your country.
No, the pharmacist.
You are developed country and maybe the pharmacist.
Yes, prepare this.
Okay, very great. You are very great. One of the other drugs is doxorubicin. Only here, okay? Radiotherapy. In some tumors, maybe do radiation for them.
Yeah.
Are you agree?
Yeah.
Radiation. What happened? What happened? What happened? What happened? What happened? واقع تو نباشید چی کنید؟
63 بعد.
Radiotherapy is the other one. Thank you, Baba.
Yeah.
Thank you, Bob.
Baba, we finished, no?
Slide
Let's go.
left.
Okay, these are our children. Pay attention when we go to oncology ward. After come back, many of our students said to me, I'm depressed, I'm sad. I couldn't eat anything today because I saw these children that they were too depressed, too thin, and the other tumor that we have is related to lymph nodes. You know, we have lymph nodes in all of parts of our body. In the neck, in the abdomen, in everywhere, in inguinal place, in the chest. If they are more than size and be large as a tumor, we say lymphoma. In infection, also we have enlargement of lymph nodes. If it is very large and stay for a long time, this is lymphoma based on surgery and biopsy. We say that's lymphoma. It is very common in pediatrics after ALL. A group of neoplastic disease that arise from lymphoid and hematopoietic system divided to Hodgkin and non-Hodgkin. You see? In adults,
Yes.
we have also in pediatric Hodgkin and non-Hodgkin. Based on pathology, based on biopsy that you get from lymph node, the pathologist said to you this is Hodgkin or non-Hodgkin. Which one is better?
Hodgkin.
Based on this, the doctor used special drugs for treatment of them. We have a student from Iraq in Iran. He works in oncology wards for adults. He said to me in the oncology, I think in Karbala, I do all of things for my patient.
Yes.
I get bone marrow aspiration. You see him, what was his name?
We see a lot of nurses in Ahmed Al-Wahli Hospital, or in Hassan Mustafa Hospital, doing everything for the patient. Yeah, and also the one nurse getting the patient, only one nurse.
Okay, pay attention. In other countries, the doctors do. But in your country, the nurses, special nurses do bone marrow aspiration and also many things. This is lymph node inflammation. You can see lymph node in the neck that is enlarged. Pay attention to your children to lymph node. If it is big and large size, think about a biopsy and confirm maybe it is lymphoma. It is the other kind of lymphoma you can see here.
Yes.
Biopsy is necessary for detecting. Maybe based on pathology that's Burkitt. Only here is. Maybe in the pediatric ward, say these children have Burkitt. Burkitt is a kind of lymphoma. Burkitt. Hepatosplenomegaly, as I said to you, because of metastasis. These are fatigue children because of chemotherapy, and many of them may be expired. Maybe expired because of infection and this situation. This is bone marrow aspiration. You can see iliac crest. You say? And also LP we said, okay, IT, this is a question about final exam. IT means intrathecal or intraspinal, and we do inject one of these drugs, maybe MTX or methotrexate, cytarabine, hydrocortisone. Maybe 3 of them, maybe 1 of them, based on the doctor's administration. One drug is MTX, that is common.
Doctor, what's your question?
What?
What is your question about hydrocortisone?
What is IT? Not about hydrocortisone, about IT. What is IT?
What is I?
It's intracranial or intraspinal chemotherapy. We inject one of these drugs or 3, all of them, to the intrathecal space for preventing or curing brain metastasis. Is it clear?
Yes.
Is it clear?
Yes.
This is cytarabine. Here, these drugs, here, that's common with you, cytarabine. Pay attention. Nurses that working in oncology wards are in danger of cancer.
Why?
Why do you think?
Do you take chemotherapy?
Because drugs.
Yes.
These chemotherapy drugs are carcinogen. You see they have a hood and prepare drugs under that or no?
Yes.
They have?
But for chemotherapy,
Yes.
the pharmacologist prepare.
Pay attention.
Not in the nurse ward.
Pay attention. Nurses in radiology, nurses in angiography, nurses in chemotherapy wards, oncology wards are in danger of cancer themselves. Okay? For woman, for man, not difference. Maybe to genetic mutation happen. Okay? Maybe, for example, you work in angiography, Mohsen.
Yes.
In the future, your children have genetic disorder. What happened? Because of you. Because of mutation of your gene. Pay attention. Pay attention. Pay attention. And RT triple, if you use 3 drugs, we say RT triple. Okay? You find?
Yes.
And this is drug side effects. Chemotherapy is very awful situation. They have many complications. Vomiting, alopsia, mouth ulcer, immune suppression.
Doctor, what's the meaning of the third one?
What?
What's the meaning of the third one?
Alopsia, hearing loss. After starting chemotherapy, you hear loss. Ulcers in the mouth for children is very painful. They couldn't eat anything, okay? Because of chemotherapy. Maybe some of them not answer to chemotherapy and died. Maybe some of them do bone marrow transplant. Bone marrow transplant is the definitive treatment we use for some children that they don't answer to chemotherapy. And also we use for all of hematopoietic stem cell disorders. For example, for thalassemia, for cancer, cancers in pediatrics is common. This is a youth, this is a adolescent that I saw him in oncology ward. He had lymphoma, and this is a Sheldon. You know what is Sheldon?
Yes.
Sheldon, you see Sheldon in dialysis? You went to dialysis?
Yes.
we did.
You did Sheldon? You see Sheldon?
We
Catheter they put for
Yes,
them.
doctor. Lumen.
Okay, yes. In this adolescent that has lymphoma, the doctor put a catheter and he went for stem cell, getting stem cell of his, and this is stem cells. These stem cells are normal. You know, all of our white BC aren't cancerous. Some of them are healthy. We get these stem cells by this machine, and this is stem cells. This is stem cells, and after chemotherapy that we did for this adolescent, and the bone marrow is zero of cancerous, we inject this Paxil, like Paxil, that is stem cell, through this catheter. After 1 or 3 years, he died. Why?
What?
He died after bone marrow transplantation.
Rejection.
Rejection. Rejection of the bone marrow transplant is the most common complication of transplantation. In all of transplantation, maybe you lost your children. Maybe, okay? This is a bone marrow transplant. Don't think this is very easy. Or and injecting stem cells.
If we suspect rejection will happen, what can we do as a prophylaxis?
Prophylaxis
Yes.
for what?
For rejection.
Anything. If, for example, you do for this patient bone marrow transplant, reject, the cancer recurrent.
Yes, before reject, it's happening.
Anything. Your body doesn't accept these stem cells, reject them.
So what can we do before that?
Anything.
What do you mean by anything?
And you couldn't do anything.
Hmm.
This reaction, okay? Maybe I accept you, maybe not. In based of genetic, immune, and maybe the other factors. He died after 1 or 2 years. By doing transplantation, he died,
Yes.
and nursing care. Oncology wards is very, very, very awful center. Every day you have a patient that is dying. Your emotion is disrupted. And what about family? Many of family
Support psychological.
divorce after getting cancer in their children. Divorce, yes.
Why?
Because of
Because the psychological pressure.
yes.
Stress.
The man said, we didn't have cancer in our family. You have.
Yes.
We didn't have cancer in my family. You have. Because of I married with you, I have cancer patients. Cancer children. Many of them divorced because of this. In my country, I don't know about you. Something that I say, it's about my country. Because I went with my students to internship, to oncology ward. We will go with you and see how is the situation in your country. Maybe not, maybe very good situation. Family support is very important, and you as a nurse, the best thing that you should do is communication, support parents, and help them to tolerate children with cancer, and that is the end.
Yes.
What time is it? We have time or no?
We have that.
2 is no.
No, we finished.
Finish
But
now.
we have time.
No, we have
Can you
Now,
discuss right now?
half an hour.
Now
Okay,
it's an
okay.
hour.
Do you have any question about cancer?
No.
Do you have any question, Hassanin? You are on the phone, on the bed,
we are
on the
sleeping.
everywhere.
We are sleeping, doctor. We are sleeping.
You are
We are sleeping.
sleeping. Okay. And me also, but
After.
lesson.
It makes you to accept that.
Okay, we go to ITP. What is ITP? This is question of next examination in the end.
How much the
ITP
question?
means
Correct, doctor.
ITP means idiopathic thrombocytopenic purpura. You know it's related to platelets. How many platelets do you have in the sleep? How many platelets do you have? What was your name, small name? What was your name, small name? Yes.
Fadl.
Fa,
Fadl.
Fazil,
Fazl.
Fazil. How many platelets Fazil have? Please know amount of your CBC, your platelet.
Just a platelet?
Yes. Fazil, how many platelets do you have? 50?
No.
2? You are in danger of bleeding, Fazil, with this platelet.
150.
You are from Karbala?
فاضل 150.
Karbala.
150 400 برضه.
Why, unfortunately? Luckily. Taha, how many platelets do you have?
Me?
Yes.
Me too. I think 11 to
11.
150.
All of class in danger of bleeding and death.
دكتور.
Let me ask of somebody that is good. 150 up to
Until
300.
400.
450. Okay, the platelet range is this. If it decreased,
Bleeding.
Bleeding.
led to bleeding, and ITP is idiopathic.
Yes, if it's increased.
Idiopathic thrombocytopenic purpura. In the reason of idiopathic that we didn't know your platelet further decreased and led to have bleeding. We say ITP. Okay? Number 1 is ITP, absence, severe signs of bleeding, easy bruising, mucosal bleeding, peteshi, menorrhagia. It is ITP. What the cause? Unknown. We go with our students to pediatric ward and I ask of them about every cause of the disease. They say unknown, genetic.
Yeah.
And also about this disease that is unknown but autoimmune. You know what is autoimmune?
Yes. Immune system in your body attacks itself.
Okay. Viral infection led to this autoimmune reaction and led to decreasing platelet. Autoantibody against platelets happened and led to bleed. the disease occur one of the two forms, maybe acute, maybe chronic. What is difference between acute and chronic?
It's a continuum more than
It takes more than
Acute is self-limiting course or a chronic course more than 12 months duration.
Yeah.
Okay? The acute form occur most commonly after upper respiratory tract infection. The mother said to you, my children was healthy. After getting a common cold, yes, she has bleeding. Some disease, infectious disease, some measles, rubella, mumps, chickenpox, or infection, or human paravirus led to platelet decreasing. Why? Because of infection. Why infection led to decreasing platelets? Because of immune. The children come to emergency and you are there, a nurse. You can see this form.
Bleeding.
What are these?
Bleeding.
Bleeding, fetish, purpura, okay? When you have bleeding in the skin, especially in children, think about platelets. When you have hemarthrosis, think about hemophilia, okay? These are fetish and purpura. Epistaxy and thrombocytopenia. You know, we need for coagulation 50,000 platelets. But for these people, less than 20,000 in millimeter we have. They are in danger of bleeding and hemorrhage, especially the brain mass. Something that affairs about thrombocytopenia is bleeding in the brain. Okay? Very, very important that treatment. Is it treatment?
Yes, good.
What is the drugs?
If it's a immune, if it's a autoimmune, we're giving prednisone.
Number one, prednisone IV.
Corticosteroid.
IV injection. Number two, IVIG. You know what is IVIG? Nurse in the end of class.
Yes.
The back of Zainab. Zinat or Zainab? Zinat. We have a nurse in back of you. What's her name? Yes. What was your small name? Asra. Okay. Do you know what is IVIG? No? Who know what is IVIG?
It's the immunoglobulin.
Immunoglobulin. Immunoglobulin. How many immunoglobulin you have? As a planet engineer, how many immunoglobulin you have in your body?
Planet engineer.
4. What's the name? IgG, IgR, IgM, IgE, Majid, D, Majid. Remember we have IgA, IgM, M, Majid, MAG, IgG, ED. Okay? IVIG is a drug full of these immunoglobulins. Okay? We say IVIG. Okay, Asra? It is usually in pediatrics. We use it for ITP. And anti-D antibody. You know anti-D antibody. You know Rogam.
Yes.
You know Rogam. What
Yes.
is Rogam?
What is wrong?
For our incompatibility.
Rogam, you didn't hear? What was your name? Small name, you are sleeping. What's your name? Yes. Muhammad, do you know what is Rogam?
No.
No Rogam.
What is rock?
Which one of the boys know about Rogam? Nobody?
Nobody
Okay,
knows.
what about girls?
Nobody
Okay, what is Rogam? What is this? In maternal.
Yes, for RH.
Yes.
It's used for women.
For
RH incompatibility.
okay, RH incompatibility. Do you know what is LH incompatibility?
Yeah.
Okay, what is this?
It's like when it's in the blood, when the woman gets pregnant, it gets
Okay.
The blood group is negative for women, and for baby
Okay.
it's different.
Okay.
So if it's negative, the compatibility, RH incompatibility will
Okay,
be
and we inject
program.
Rogam in pregnancy. Rogam has a form that's IV line that we use for ITP patients.
Yes.
We say anti-D antibody. Okay? For controlling ITP we use.
Nobody knows.
This is bruising
Yes.
related to ITP, and this is ITP also, and treatment. Question of the exam. Can we said in ITP the problem is platelet, lower than normal. Can I inject plaquette to you? What was your small name? What was your small name? What? Sajjad, can I inject to you as ITP children platelet? No. Why not? Your problem is decreasing platelet. I wanted to inject platelet to you. Who said? Do you agree that I inject platelet to you? Why not? Why not?
Yes, that's the one.
My problem is decreasing platelet, but you give me immunoglobulin, cortisone, prednisone. Why don't you inject me platelet? He's representative of the class. Very active.
Doctor, because the body is react and reject the
Pay
platelet.
attention. I said the problem is your body against platelet is active and destroyed them, damaged them.
So if I inject platelet, I'm in
Yes, the immune system is more active for damaging it. Okay? Do you find Mahdi? Yes or no?
Yes.
Mom, please explain for Mahdi. He's asleep.
No, I know. Explain it.
I'm
Yes.
explaining to him.
Yes, explain.
When you inject more platelets in this patient, the body defense immune system gonna attack this platelet.
I already know this information.
Okay? Do you agree that platelet injection is banned, is not advised for them? If you inject platelet, the immune system is more active to decrease platelet, and the situation is the
More
worst.
progress.
Doctor, I want a question of final exam.
I will work with you at the end session, not be absent. I will give you some samples and resolve them.
You have to tell us about more than 20 questions.
About
About the,
Yes,
maybe we
I
have
am first grade.
maybe the question, yeah. Don't worry.
100 question.
Doctor, انت عشان
No,
summarize
100
summarize
is too more. No problem, no stress. But please read all of our files
ايه
carefully.
Inshallah.
And in the class, I'm saying to you the question, the reason, and everything.
Inshallah.
One of the question is about getting platelet, injecting platelet.
What?
Injecting platelet. Is it possible? No. It's better not to. One question that I have is splenectomy in chronic ITP. What's your idea?
What?
We do a splenectomy about chronic ITP.
Yes.
Why?
To prevent the reaction of the blood.
Spleen is responsible for damaging platelet. In chronic ITP, we remove spleen to cure chronic patients. Many of chronic patients is died, expired after many treatments. Pay attention. Vinro SD or anti-D is Rogam in the form of IV that we use for ITP. What is this? This is IVIG.
It's IVIG.
IVIG is very, very expensive in all of the world and also in your country that is too expensive. Used for ITP patients. Very important, platelet infusion is prohibited. Okay? Nursing care. Something that you love it is nursing care. Number one, supportive, teaching, and pay attention to blood in the brain. Educate about this to the mothers, about bleeding especially IVH, intraventricular hemorrhage.
Doctor, the human albumin, it's a contain of immunoglobulin?
No. Albumin is also albumin. You know, albumin is a protein in your body.
But
In albumin, we have only albumin.
it's not to have any percent of...
No, water and albumin, no. IVIG, no. Immunoglobulin, no. Immunoglobulin, also this is. This is what that is. I didn't know where is that. I showed it to you.
Doctor, it's a IVIG, same we use it for Stevens-Johnson syndrome?
Yes. Maybe, yes. In severe form. IVIG led to increase your immunity of your body. It's Majid. IgM, IgA, IgG, IgE, IgD. Majid. Remember Majid for immunoglobulin. And nursing is supportive and educate the mothers and educate about contact sports, bike riding, skateboarding, gymnastics, climbing, running. These sports are dangerous for the children. Okay. Supportive, platelet prohibited. Do you have any question about ITP?
No.
What time is it?
Finished.
Finished.
Yes.
Yes.
Everything that Walker said. Finished.
Yeah, finish.